space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Rednam.
Welcome to the Confidence Doc podcast. I'm Dr. Rednam, and I'm a board-certified plastic surgeon with my Houston surgeons. And as you can see, we are in the Houston area. Today, I wanted to talk a little bit about something that is truly personal for me, and it's considerations for women of color when it comes to plastic surgery treatments. And there has to be consideration because when you are a woman of color, and this can be a number of different ethnicities, how you are treated and how it comes to incisions or heat-based treatments does have to be really carefully thought out and planned to get the best results. I can tell you, as a woman who's had plastic surgery and one who treats many women of color, the biggest difficulty we have sometimes is how do we get not only the scars to look good, but how do we get them not to hyperpigment? Most women and men who have pigment, and that comes from the melanocytes in our skin, the melanocytes can come in very different configurations based upon ethnicity. Even someone who is considered white has melanocytes. They're just not the same type of melanocytes. You have eumelanin and you have other types of melanin that you're going to see in darker skin types. And so we have to think about these things. That's why one of the questions I often will ask my patients is, how do you tan? It's just because you don't look like somebody who's darker skinned, you may be somebody who tans very easily. If you tan very easily, it does mean that you have a larger number of melanocytes. And like I said, how they're grouped and how closely they're grouped to the surface can vary based on different ethnicities. So why is any of this important? It all comes down to is everybody wants the scar that fades away and can't be seen. And it is more of a challenge, like I said, because what we have found is people who do have more melanocytes are more prone to something called post-inflammatory hyperpigmentation. And this is more common in areas of inflammation. Well, guess what? Surgery is all about inflammation. Our whole body gets inflamed. And certainly wherever we're making incisions, wherever we're performing treatments, we're going to have inflammation. So let's talk about it from a surgical incision standpoint. What this means is that especially on somebody who has more tone and pigment and color in their skin, I'm going to make sure I use cold steel. That means I'm incising along the incision. I'm going to try to use less cautery because heat can absolutely increase the amount of inflammation and increase the chances of us getting that hyperpigmentation afterwards. For some people, PIH, that post-inflammatory hyperpigmentation, is very temporary and 100% fades over time. For others, it can be forever. It may lighten with time, but it can stay forever. So that's why these type of considerations are really important. It seems like small details, but plastic surgery and good results are all about the small details. Other things that can introduce heat into the body are things like VASER, things like Renuvion, or radiofrequency microneedling. All these can be heat-based devices and can cause more inflammation. Now, that's not to say that they're not great devices, because all of them can be in the right hands. But the goal here, again, is to get nice results, get the effects we want from these devices without then having the long-term complications of inflammation and hyperpigmentation. On top of it, though it's not only seen in people of color, you can get thicker scars. So keloids are much more common in those of darker skin, especially those who have Asian ancestry. You may see keloids in somebody who has fairer skin types, who wouldn't necessarily be considered a person of color, though it's not as common. We do know, again, that having keloids or hypertrophic scarring comes down to inflammation. So keep using that word inflammation, because the goal with any of these things to reduce it is then to reduce the amount of inflammation in the skin. So again, I do this by minimizing the amount of heat that makes this contact with the surface. I do use steroids and sometimes 5-FU, which are both potent anti-inflammatory medications that might be simply in my mixture of my tumescent, the fluid that I put in with liposuction, or it may be something that I'm injecting or topically using afterwards. TXA is another really potent anti-inflammatory medication. It's often used in the context of coagulation, so trying to prevent bleeding, but it can actually also be used topically and injected for areas of hyperpigmentation due to inflammation. Now, there's a lot of devices now that have come out there that are trying now to see, how can I get the effects of a laser? How can I get the effects of tightening, but without potentially causing this PIH? One that I'm a big fan of is the Helix laser by Cartessa. It is something that I own, so that is a disclaimer there. So yes, I'm biased towards it, but I'm biased towards it because I think it works. It's a laser I've had myself. CO2 is a laser that has typically not been one that that's been recommended if you have darker skin types, specifically skin types like mine are darker. And that's been because of getting the untoward effects of either having hyper or sometimes even hypopigmentation. Well, what they did with this device is that they said, okay, we want to be able to deliver the CO2, but we want to be able to deliver it in a safer way. So there's different patterns to deliver it. There's different strengths that you can deliver it and different depths and how you deliver it. So it's basically, in my eyes, a smarter CO2 device. There's also other devices like radiofrequency microneedling that what they're trying to do now is, can we deliver it deeper? Can we deliver it faster? Are there ways to cool down the skin so that as soon as we get the heat that we then now reduce the inflammation? Simple devices that a lot of places will use are things like the Zimmer devices, which are directly cold onto your skin. That's simply one brand. There are other devices that do this as well. Afterwards, post-treatment's really important. You don't want to lock heat in when you are getting a heat-based device as a person of color. So what we want to do afterwards is we want to cool the skin down. We don't want to use any sort of skin products that are going to lock the heat in. We want the skin to be able to breathe, cool down completely before then we use a ointment or post-treatment that is then going to seal the skin. These are small things, again, minor details, but these minor details make a huge difference. It's an area in plastic surgery that I think we have a lot to learn and a lot of growth for. I'm very proud that the med spa that I am a medical director in will be having their Women of Color event coming up on September 14th. And we are going to start talking. We're going to start the conversation, start talking more about how we can prevent some of these complications that we only see in those who are people of color. We want to make sure that aesthetic treatments are available for everybody and they're safe for everybody. We know a lot about lesser pigmented skin types because most studies have been done on those skin types. So this is not in any way to exclude anybody, but just really to bring people of color into the conversation when it comes to post-aesthetic treatments. I think that companies are becoming smarter. And I'm talking specifically about aesthetic companies, that they are really looking into, hey, are my devices good for all skin types? If they're not, what can I do to alter or make them safer? What can I do to educate and make sure that everybody is included in the aesthetic conversation? So this is just a little sneak peek of that evening that is coming up in Houston. But I do want to make sure that people understand that there are people that understand how to better take care of people of color when it comes to the complications of scarring and post-inflammatory hyperpigmentation, and that as a patient, it is absolutely okay for you to ask your surgeon, it's absolutely okay for you to ask your esthetician, hey, do you see a lot of people that look like me? And if so, do you know the special things that you need to do for me for these treatments to get the best results? And if they don't, it's okay to say, well, maybe this isn't the right person for me. I think that we are trying from a curriculum standpoint in plastic surgery education, as well well as definitely dermatology education, trying to make sure that we understand every skin type, every skin color, and how it reacts to treatments so that we can provide the most broad, safe treatments to all of our patients. So this was, like I said, just a little sneak peek into that. I definitely want to cover more about this topic, and it's an area that I'm hoping myself to provide more into the research of so we can provide the best care for our patients. So thanks for joining in on this little snippet of the Confidence Doc Short.
As we wrap up another episode of The Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.